Well, good afternoon. It is Tuesday afternoon. I believe it's Tuesday. Maybe it's Monday. Oh, it's Tuesday. It's Tuesday, July 3rd. I'm Corey Babb, and it is time to do another Facebook Live video. Today, we're going to talk about a couple of different things. One of the first things being the new kind of passing of a bill in Oklahoma that legalizes the use of marijuana for medicinal purposes. The second thing is also going to be just kind of our normal Q&A talk as far as sexual medicine, menopause, hormone replacement things along those lines. Just like with any other of these videos that I do, if you have questions during the video, please feel free to make a comment or let me know, send me a message. I'll leave the video up for a good while afterwards so we can really kind of talk about things, or if you want to share it or anything along those lines, that's totally fine too. So kind of getting into the heart of the matter, obviously one of the things that passed on June 26th here in Oklahoma was a state question that basically allowed for the use of marijuana for medicinal purposes. Now, it's interesting in that marijuana, if you kind of look historically, has a very long and sordid past. We know that people since time immemorial have used herbal medicines. They've used plants, they've used parts of the plants, they've made these into different compounds, they've either smoked them, ingested them, made them into teas, whatever it may be. Herbal medicine has been something that has kind of existed as long as humanity has existed. And still today, we have people that are registered herbalists in this country, not so much, but especially in other parts of the world, you see herbal medicine kind of being the go-to for a lot of people for their health care. So I think you have to kind of understand that history when you're looking at marijuana, especially in using it medicinally, and how that kind of plays into everything. The second thing to look at is, really how does this bill being passed affect not only you as a potential patient, but also providers, who gets to partake of the pot, if you will. And so I want to kind of look at that too. So before we really dive into the heart of the matter, I think we need to kind of look at marijuana and what really makes it something that is medicinally usable. So now marijuana is the kind of, folk name, generic name, whatever you want, of a type of cannabis plant, cannabis sativa, which is one of the kind of the three main strains of it. And the cannabis that is in the marijuana plant, or that is in the plant itself, is what actually has the psychoactive properties. So cannabis, so the THC, which is the kind of biochemical compound within cannabis, which is tetrahydrocannabinoid, works on our brains endogenous, what are called endocannabinoid receptors. Now, CBD oil, which a lot of people, may see around town, or you may see it out, is a kind of version of that, and that's a cannabidiol, I think is how you pronounce that. And so it's a variant of that THC. And a lot of CBD oils will have varying degrees of the psychoactive THC within them, and different types of cannabis plants have different degrees of psychoactive properties as well. People that are involved with the marijuana industry sometimes say, well, if you use the sativa, it gives you kind of this type of high versus another one that gives you this type of high, whatever. All of those things to say, we know that the THC that's there acts on our brain, and it acts on those cannabinoid receptors. So what does that do? Well, I think most of us have at least some passing knowledge of what people who either smoke marijuana or use edibles or whatever it may be kind of act like. We know that marijuana, kind of in culture and society and things like that, you have people who are stoned and they act very kind of peaceful and euphoric, and they are hungry, and they have kind of all these silly antics that they can get into. Dude, where's my car? That basically is a movie that what happens if you were stoned your entire life. But when we look at that and kind of extrapolate to medicinal uses, it really is kind of interesting how we can use this medically. So, and I'm also going to put a caveat in here too. that if you are going to use marijuana medicinally, if you are actually going to say this is a medical plant, we're going to use it like a medical drug, like a medicine, just like ibuprofen or antibiotic or whatever it may be, then you have to treat it as a medicine, which means it's going to have dosings, it's going to have interactions, there may be contraindications for it. You can't just say, okay, well, we know that this plant, just because it's natural, is a panacea. It's going to cure everything and it's not going to have any problems at all. Obviously, that's not the case. No medicine, no matter whether it's natural or pharmacologic or synthetic or whatever it may be, is without potential risks. Granted, we know that it's unlikely that people can overdose on marijuana. The kind of concentration required to kill 50% of rats that have been given THC is so freakishly high that there virtually are no cases of humans overdosing and dying due to that specific THC molecule. But there are interactions with it, and we know that some people are going to be more sensitive to those endocannabinoid effects, just like someone may be more sensitive to birth control pills or to different types of blood pressure medications, whatever it may be. So there's my caveat. If you're going to call it a drug, it needs to be treated like a drug. And therefore, you need to kind of look at it as, is it going to react with other medications? Is it going to react with other health conditions, things along those lines? So let's step back to that biochemistry and kind of look at what it does. So remember that the endocannabinoids, our body produces basically are feel-good chemicals. So if you do something that your brain says, hey, I like this, that's really good, it's rewarding, it will send out a dopamine surge, and that dopamine surge kind of will react not only on the dopamine receptors in your brain, but also causes the release of some of these endogenous or endocannabinoid molecules. So it's, that feels good, I like doing that. We see this a lot of times in people that have kind of addiction problems. They have this constant dopamine release, and that fuels the addiction. So people who say are addicted to gambling, every time they go to a slot machine, they pull the handle, and it's that, ooh, am I going to win? Am I going to win? Whatever it may be, and your body says, hey, I like this. I like how this feels. Boom, dopamine surge. I want to do this again. So those endocannabinoids are there to kind of act as that feel-good type of sensation, if you will. Now the flip side of that is when our body is in pain and what are called nociceptors, or kind of pain sensors, are firing, our body will send out endocannabinoids to kind of dampen that sensation. That's why a lot of times people that are in massive traumas, in addition to the adrenaline that their body sends out that's helping kind of make their heart beat faster and kind of get them quote unquote out of danger, it's also sending out these endocannabinoids to basically dull that painful sensation so that they can, if they were being attacked, they could escape or whatever it may be. So you have this kind of dopamine effect and this endocannabinoid effect that's making you feel good, that's making you kind of want to, do whatever activities you may be in. And so that's really kind of one side of the drug. And we see a lot more dopamine effects actually with THC versus the CBD. Now, if you look at sexual functioning, and you guys have heard me talk about this before, especially if you've watched any of these videos, when it comes to sexuality, when it comes to sex drive and our libido, your brain has excitatory and inhibitory components. The excitatory neurohormone, and the main one, is dopamine. So we know then, we can say, kind of extrapolate, okay, well, if I'm getting these big dopamine surges, this is making me want to do these things, I'm feeling good, I'm feeling sexual, great. The inhibitory side of things is serotonergic, or based on serotonin. This is why sometimes people that are on antidepressants may have a lower sex drive. It's because that serotonin level is high, and especially if that antidepressant is a selective serotonin reuptake inhibitor like Prozac or Lexapro or things like that, it may be causing a false elevation in the levels of serotonin, therefore keeping them from getting excited. They're kind of more inhibited when it comes to their actual libido, their sex drive. So now let's step back again and kind of look at that and how this relates to THC and CBD. So like I said, if you look at some of the studies, the THC actually has more of that dopaminergic effect. So in theory, someone who is not feeling very sexual may get a boost in their sex drive when they use some sort of THC product, whether that's smoking marijuana, whether it's using edibles, tinctures, which are, you take the actual the chemical and you kind of infuse it into very high grain alcohol and let it kind of steep there, and then put that like as a dropper or whatever it may be. Now it's really interesting because a lot of times when we think about people that are using marijuana, especially people that are using marijuana a lot, we kind of have this social picture of someone that's just kind of lying on a couch and they're eating pizza and they're like, yeah, man, I feel pretty good, dude, whatever. Not really someone that's really, going and initiating a lot of sexual activity. So then where do we get also this kind of common idea that marijuana can help with sexual functioning? Well, so here's where we kind of have to look at the other part of this. So remember that your kind of typical stoner, when you think of them from a cultural standpoint, is a very relaxed individual. And we know that both the THC and the CBD, all of those chemical constituents act to promote a euphoric mood in the user. It kind of relaxes them. It creates a sense of well-being. They feel good. They may want to eat something. They want to kind of relax. So from that neurochemical standpoint, what does that sound like? Does that sound like someone who's more dopamine kind of infused and wanting to go out and do all these things, or does it sound like someone who's more serotonergic and wanting to kind of rest and relax? Well, it really is more of a serotonin type picture. So in people that are using the THC and its derivatives for sexual functioning, the question you have to ask yourself is it working on kind of that excitatory phase? Is it working on that dopamine, or is it working more on serotonin? Well, so this is kind of what the research has done, and there's not honestly been a whole lot of research done on this, especially because up until this point, marijuana has had varying legal degrees of success across the country. But what they found is that both men and women that use some form of THC, and this was really looking more at CBD oils and things like that, but they did actually look at THC too, is that on average, they had one more sexual encounter a month versus their kind of non-user counterparts. And they said women who didn't use it would have on average 6 sexual encounters a month. Men who didn't use it would have on average 5. And then so women who did use it had 7, and the men had 6. Is that statistically significant? Well, I mean, I guess you could say if you had 5 and now you had, gained it by 1, well, you have a 20% increase in sexual activity. Okay, sure, that's kind of interesting. But the big question is, why? And that's right. So would it not depend on which strain of marijuana for sexual function? That's exactly correct. I'm getting to that. And the orgasms are awesome. So I have heard. I've had multiple people say that before. So when you look at why this was the case, you really have to step back and say, okay, so were these people coming from a, normal, quote unquote, sexual functioning, or were they dealing with sexual dysfunction? If they're normal sexual functioning, great. Maybe that's just kind of how things were going. But for people who are using THC, CBD, kind of the various forms of marijuana for sexual, or to help combat sexual dysfunction, you really have to look at the whys. And so when we think about that, think about low libido. So, and remember, in terms of sexuality and sexual medicine, we have kind of these differentiators. So for sex drive, we have, is this something that has been acquired, or is this something that is lifelong? So obviously, if it is lifelong, it has always been like that. If it's acquired, it's something that's different. It's new. This is someone who had a great sex drive and then had kids, and now they have no sex drive anymore, period. That is an acquired thing. It's an acquired issue. If you look at one of the main causes for acquired hypoactive sexual desire, so acquired low libido, we see anxiety about sexual functioning being up there. That's definitely one of the main things that is causing this. And the reason that that causes that is because the more anxious we are, the more our body views whatever situation that we're in as a kind of a fight or flight response. And this all goes back to autonomics, just like almost everything else with sexual functioning. But remember, fight or flight is your sympathetic nervous system, and your rest and digest is your parasympathetic. So if you view sexual activity as a panic type response, or as an anxious type response, or something that is potentially dangerous, quote unquote, that's kind of our first key. Because in that case, your body has a really difficult time, or I should say your brain has a really difficult time differentiating, ooh, I'm nervous about having sex because it may hurt, or because I've got other things to do, or whatever it may be, from, holy crap, there's a bison about to gore me and I don't want to be reproducing right now. So it says, you know what, all stressors are the same, all anxiety producing things are the same, and it goes into fight or flight response. And what that does from a physiologic standpoint is it pulls blood away from your genitalia. And it tells your brain, don't focus on reproducing right now. You need to escape the bison that's about to gore you. So for people that have acquired low libido, especially if it is due to, say, a history of painful intercourse, and they are always anticipating some pain with sex, even if they've come and they've gotten treated for it or whatever it may be, that is going to, be someone that the marijuana and its derivatives may be beneficial for. For someone who always has their brain kind of going, 20 miles a minute, and they're thinking, okay, I've got bills to pay, I've got, the kids are screaming, I've got blah, 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 whatever it may be, that is someone that marijuana and its derivatives may be useful for to help their libido. Someone who says, I'm just not really a very sexual person, I'm just not really into that, I don't have a problem with it, but I just don't really feel that's not my bag, baby. They may see kind of varied success from it. Now, obviously, some people say, no, it can treat everything, but from a biochemical, physiologic standpoint, if the problem is not that you're getting too much panic response, too much sympathetic innervation, it may not give you the result that you want. So here's my third cesarean caused acquired low libido. Okay, so let's take that for a second and step back. So what about that potentially caused it? Is it that there was pain associated with the surgery? Was it a change in body image afterwards? We know that obviously as ladies get pregnant, they feel that their body is not, may not be as sexy as it was before. Is it the fact that you've had 3 C-sections and now you've got, at least 3 kiddos probably running around? Is that kind of changing the way your brain is thinking? So there's all those things that go into it. And for someone, who may be dealing with those potential causes of their low sex drive, the CBD may not necessarily be the best therapy for it. Now, and you've probably heard me say this before, Becky Lynn, who's a fellow sexual medicine provider, she's up at St. Louis University. She is kind of the guru on sexuality and marijuana and kind of how that all ties in. So if you really want to know more about this, you really want to delve into it, she also has a Facebook page and a YouTube channel that I'll probably put links onto so you can go in and see. Now let's take back and let's kind of look at things from a pain standpoint. Now we know, remember like we said before, that THC, the cannabinoids in there kind of stimulate or plug those endocannabinoid receptors in our brain. So if you have someone that has painful intercourse, maybe they have vestibulitis, it hurts with initial penetration because the vestibule is so inflamed, it's red, it's very painful, it feels like there's broken glass rubbing on their vagina anytime someone tries to do anything. Having that exogenous or that kind of extra source of those cannabinoids may help, with reduce that discomfort. Now, is it going to fix the pain? No, by no means. It's just kind of a bandage for it. But sometimes that's what you want. You don't necessarily need to have everything fixed all the time. Maybe you say, hey, I'd really like to kind of enjoy this night out. Adenomyosis, maybe, that's true as a potential cause for that. So in that, I think that's something that really needs a little bit more research. I think that's something that needs a little bit more kind of looking into. And we're really in the infancy of this, kind of looking at how we can use THC and CBD and all of these marijuana derivatives or these cannabinoid derivatives medicinally and safely. Because we do know there are people that can, like I said before, overdose on them not from a lethal overdose, but they can get to where it provokes, panic or paranoia, suspicion, things along those lines. And obviously, if you're trying to get into a sexual situation, that's the last thing you want. You don't want to be like looking around all the time, wondering if the man's going to come and get you, whoever the man may be. So I think that kind of the moral of all of this, from a sexual medicine standpoint, is we need a little bit more research. We need to really figure out, and we can't use it as a panacea to cure every sexual disorder. Now, like we said kind of in the comments before, obviously orgasms with marijuana tend to be a lot more potent, a lot more impressive. Is that because it's affecting those endogenous cannabinoid receptors and it's kind of causing that release? Well, most likely. So we can kind of explain these things from a biochemical standpoint. But the flip side of that is, especially if you're getting too much of that serotonergic activity, or too much of that parasympathetic rest and relaxation type activity, it's very difficult for the brain to make that switch to go from parasympathetic to sympathetic, which is what it needs in order for you to orgasm. And that's why we see a lot of times people that have, either anorgasmia, they can't orgasm, or they have oligoorgasmia, or they have a very infrequent orgasm when they are using antidepressant medications, because that elevated serotonin is inhibiting that flip from parasympathetic, which is what's required for arousal, to sympathetic, which is what's required for orgasm. It's just you can't get that drop in serotonin to do that because you've got all this extra serotonin floating around. So same could potentially be said of people that are using, are getting more of kind of a serotonergic effect from the CBD and THC and all those things. So obviously that's kind of my medical standpoint on that. Feel free to send me questions if you'd like otherwise. But something that I do want to talk about is, from an Oklahoma specific standpoint, what does this mean moving forward for, patients, for providers, all these things. And obviously I am no means an expert on this, but looking into the bill and looking into, what we can do to kind of further sexual medicine, and is this a potential treatment for women out there, it's definitely something that I wanted to kind of familiarize myself with. So we do know right now that there are going to be some separate kind of licenses, if you will, required for both prescribers and partakers of the drug. Likewise, there has to be distributors and there has to be growers, and each of these, with anything with bureaucracy, the more kind of divisions in it you can make, the better. The bureaucracy is expanding to meet the expanding needs of the bureaucracy. That's what Oliver Wendell Holmes said. And so in looking at that, as someone right now, let's say if I had a patient come to me and say, well, I want you to prescribe me this marijuana for my painful sex. Say, okay, well, let's talk about it. Say, okay, well, yeah, I can see why that could be potentially useful. What would be the next step required? Well, I would have to go and basically have gotten certified in order to prescribe the marijuana or its derivatives. And then they would have to go, after I handed them a prescription, they would have to go to a dispensary. So that person would have to have put in the fee, or paid to get the dispenser's license, who would have to have gotten it potentially from a grower who had to pay the fees to grow it. So there's all these kind of, hurdles at the road at the moment. I do think that in the next year, and our next couple years, we'll see this becoming much more streamlined. But the big thing that I am concerned about, and the thing that I would caution you if you were thinking about this, is not to go to some of those people that are just doing this as a moneymaker. Because remember, if you go to California or some of these other states where this is legalized, the marijuana dispensaries kind of exist out of the law a little bit. And, like there are ones in California that only take cash. You have to go to there's an ATM on site. You get your cash from the ATM and you go and you pay there, and that's it. So if you need a prescription, are there going to be, less scrupulous providers that may say, hey, for $300, I'll give you a prescription for it. Sure, you've got anxiety, or sure, you've got knee pain, or whatever it may be. So, I think we're really going to have to kind of work to watch that. And that may be an area kind of where we worry about use and kind of overprescription of this, and people that are, that don't have actual medical indications. Now, I have some people, I've heard them say, well, people are doing this anyway, might as well, make it, like, tax them for doing it. And I guess there is some truth to that. But like I said, my big concern is that you'll find these kind of, pot docs around that are just going to say, hey, for X number of dollars, I'll write you a prescription. And it's just, I don't know. I don't think that's the best thing as a physician to be doing. So. Does anyone have any more questions about marijuana and some things like that? Obviously, like I said, I'll make sure that I post this up, and you can send me a direct message if you'd want. Otherwise, I did have a couple of questions sent to me prior to the video. One specifically kind of looking at the development of some, how emotions kind of go after delivery. Now, this patient of mine had twins, had previously had a single son, and afterwards she had some postpartum mood issues that required the use of Zoloft. And we use Zoloft quite a bit, especially in moms that are breastfeeding. It has a very good lactation profile. And she was able with the Zoloft to pretty much do kind of get past the mood issues there, and to feel like she was a good mom and all the wonderful things that go along with that. But now, after having twins, she's finding that she's having some issues with irritability and snapping and that low sex drive and kind of all those things together. So is this something that's hormonal? Is this something that is emotional? Is it something that's medicinal? Kind of where does all this go? So obviously we know postpartum-wise, remember that when you go from 1 baby to 2, and especially if you go from 1 to 3 or 1 to 4, you're dealing with a whole heck of a lot more stressors at once. Excuse me. And the fact of the matter is that you as a person have to feel emotionally well in order to take care of yourself, take care of your kiddos, take care of your spouse, your partner, whoever it may be. So saying that, well, I tried with one therapy with 1 baby, but now things have gone, much more different, much crazier. Why isn't it working? Well, it may be that there are other things to do. Maybe there are other things to consider. We know that the hormones that are going on postpartum, especially in the first year of postpartum, are still kind of irregular, still, odd. And then for moms that are breastfeeding, especially immediately after delivery, they have a pretty significant drop in estrogen. And as that prolactin goes up, that kind of inhibits that estrogen anyway. And so you get a much more almost menopausal type mood change there, a menopausal mood swing, if you will. And it does, especially as that's kind of reinforced with the more breastfeeding and the lower estrogen, and then the lack of sleep, and then trying to worry about, how am I dealing with my other, child? These things kind of compound. They all come together. And it really can amplify any pre-existing, emotional issues that you may have. So that's something to kind of think about. Just because, after 1 baby, things were okay. Now you've got not only the issues with dealing with 2 babies, you've got the sleep deprivation there, you've got the hormonal changes there, and then you have a potential guilt in that you're not giving your first child enough, love or affection or whatever it may be. So a lot of times when we have moms who previously dealt with either postpartum depression, postpartum anxiety, and were able to be managed medicinally, with subsequent children, we usually either have to increase the dose of medication, change the medication, or kind of use an alternate form of therapy. If you've listened to any of these before, I'm a huge fan of counseling, but as we all know, counseling works great if you can go to it. If you can't go to it, that doesn't really help a whole bunch at all. So what I would probably recommend for that Yeah, twins are just tough. You are exactly correct. There are obviously mother support groups out there for mothers of multiples. There is a mothers of multiple support group. And no matter where you are, trying to find other women or other families that have that same multiple milieu of kids can provide you a little bit of respite, especially if you say, well, I'll watch the kids tonight if you will watch my kids at a later time. The other thing to really consider, and the thing that we don't talk about enough, is how much sleep plays into this. We know that sleep deprivation is, huge when it comes to emotional issues. I mean, you think about kids. If kids are tired, how do they get? They get irritable, or they get hyperactive, or they go and they, pee on their sister for no reason, whatever it may be. And so much of it may be because just simply fatigue. They can't handle the stressors and deal with them in a quote-unquote socially appropriate way, because literally they're at the end of their rope. If you imagine a bathtub and you have it turned on and all of the water that's going in there is the anxieties and the worries and the fears and all those things, and you have it kind of at a normal flow rate. When we are sleep deprived, it's like someone cranks the water all the way up. And unless you have that drain open and have a way to kind of let all of those stressors out, it is going to build up and overflow very quickly. So you got to find either a way to turn down the faucet or open the drain. Otherwise, you're going to have those reactions from it. Other than that, I think, like I said, it may be something to talk to your provider about in potentially switching medications too, or at least seeing if there are other things that can go along with that. But if you can, something that you can do at home, try and sleep. I wish that we could have, I'm sure I know there are like postpartum doulas or, sleep doulas that will come over and help moms with kiddos that, are having sleep problems. So that may be something to look into as well. So that, I think, kind of ties it about up today. Unless anyone has any other questions, I'll kind of scroll through, things here. Excuse me. Allergies here. Right near, Shannon's putting some stuff on here for, twin moms, no fee for joining, like with Super Moms of Tulsa. So. All righty. Well, just like always, if you have questions, have concerns, anything like that, feel free to send me a direct message. Obviously, we have a lot of kind of good resources out there right now, and we're learning more all the time. So don't be afraid to ask questions, talk to your provider, and see if you're suffering or you're having issues, especially with this new marijuana stuff. It may be something that could work for you, especially in the future. But remember, caveat once again, if you're going to treat it like a drug, then you have to actually treat it like a drug. That means, is it going to react with other medications, other herbal substances? Are you a good candidate for it? And is it given in proper dosage and proper indications? So that's about it, I guess, for today. I'm Corey Babb, and so you can take yes, you can send me direct messages, Shannon, as long as they're not too crazy and not crazy all the time. But of course, I will say the caveat is if you have questions about medications or you need refills or things like that, probably the best thing to do is to call the office and they'll take care of that. Otherwise, have a wonderful afternoon. Have a happy 4th of July. Stay safe. Don't get exploded by fireworks. And we'll catch you later. Bye-bye.